Hi, my name is Sheri DeSchaaf, and I am a doctor of physical therapy specializing in women's health. And I am now 7 days postpartum after having my first baby. And I wanted to shoot a quick video for you guys on what kind of exercises you can be doing at this stage at 1 week postpartum, and even the whole week this week that you can and should be doing these. Because a lot of women ask me that, both patients and just friends of mine ask, okay, what can I start doing right away? And I'm going to share with you 2 things that you can start doing right away. Obviously, you always want to keep in mind listening to your body. As your healthcare provider has probably told you, you want to keep an eye on your bleeding. You should never see any increase in bleeding with your exercises or afterwards. You should never see any increase in pain, either in the pelvic region or the abdomen during or after your exercises. If either of those things happen, you're going to want to stop and just talk to your healthcare provider about that. But the 2 things that I want to share with you are a pelvic floor contraction and also a transverse abdominis contraction. And the pelvic floor contraction, pelvic floor, if you haven't heard of it, it's a set of muscles that sit inside your pelvis, and they kind of hold up and support the vagina and the uterus, the bladder, the urethra, the rectum, all those good things that are inside the pelvic cavity. So very, very important for your recovery after childbirth, because it can be quite traumatic to those muscles. The second one, transverse abdominis, is a deep core muscle that kind of wraps around your middle and obviously gets very stretched out during your pregnancy, and that's a very important muscle for us, just for core stability, for balance, for breathing, for general function in your life. So both of those you want to start rehabbing immediately. They're very gentle, simple exercises, but at the same time, right after delivery, you may have a lot of trouble even just finding those muscles and finding how to activate them again, because they're so out of whack from what they were before you got pregnant. So just be patient with yourself. Again, watch your signs of bleeding and pain. Otherwise, these are both generally completely safe for you to do starting day 1 after you give birth, if you're up for it. So you can do them both in a sitting position, and that's how I've been doing them for the past week. I've also been working them in with my schedule, because as you know, with the new baby, it's hard to kind of work things in. When am I going to have time to exercise? So this is something you can do while you're nursing, which is great. If you just make it a point to do 5 to 10 repetitions every time you nurse your baby, you're getting plenty of repetitions to make progress. So it's a good way to kind of work it into what you're already doing. It's also something to do while the baby's sitting there. So the first one we'll talk through is pelvic floor contraction. This is a little bit tough for a lot of women. You want to sit up nice and tall, good posture, or you're leaning back reclined. You know, if you're nursing, you're going to lean back reclined against whatever surface you're sitting on. And you're going to gently take a breath in, and then as you exhale, you're going to draw up and in like you're trying to stop the flow of urine. So it's a very gentle contraction. You're just thinking about the musculature that surrounds those openings, the vagina, the urethra, and the rectum, gently closing, and also that tissue kind of lifting up into the pelvis. It's been pushed down and out for the last 9 months, especially if you had a vaginal delivery. So you want to think now about kind of lifting up and in and getting some of that muscular support back. So just do 1 rep with me. We're going to breathe in and then out. You're pulling up and in on the vaginal area and then releasing. You only have to hold for about a second at first until you get the hang of it. You feel like you're doing it correctly, and then you can start holding a little bit longer. I would go 5 to 10 repetitions at first, again, each time you nurse. The second exercise is the transverse abdominis contraction. And the transverse abdominis we talked about wraps around the abdomen this way, so it gives you support to your spine, your pelvis, and your diaphragm, and everything that's in your abdominal cavity. So it's a pretty important muscle, especially since you're doing a lot of lifting and carrying and moving things with baby. You want to have a nice strong muscle back there. So with the transverse abdominis contraction, we're going to inhale, letting the belly, kind of feeling the belly expand a little bit. And then as you exhale, you're going to think about that belly button drawing back towards the spine. You shouldn't be doing a crunch. Your rib cage shouldn't be coming down, nor should it be flaring up. You shouldn't feel a ton of stuff in this upper abdominal area or on the sides. You really want to feel it kind of down below the belly button, kind of between the pubic bone and the belly button. Focus on that area. So we're going to breathe in and then exhale, and I can feel with my fingers there that lower abdomen area is kind of just gently pulling in, very gently. One thing I want to mention, if you watched my last video, I mentioned wearing the abdominal binder right after delivery for some extra support. I'm 7 days postpartum now and I am still wearing that. So if you have one, I would encourage you to keep wearing that, especially, you know, with your day-to-day stuff around the house, with lifting the baby, moving things, carrying things. You're asking a lot of your core, and even though you might not realize it. So I took mine off for a few hours this morning and a few hours last night, and I can definitely still tell a difference when I have it on and when I have it off, to how well I feel like my pelvis and my abdomen and my trunk are being supported. So I'm just keeping that on until I get more into some of these core exercises to get the support back from the muscles. So I hope this has been helpful for you. If you have any questions at all about exercising during or after your pregnancy, please feel free to check out my website and email me if you need to. And I hope you have a great pregnancy and a great birth.